is noon, so we'll be respectful of everybody's time and get going. First and foremost, I want to welcome everybody. As people still pop on, that's great. At the top, I want to let everyone know that this is a recorded session, so it'll be sent out to everybody that registered, whether they are here today or not, and then it will be posted. So if you miss anything, you're trying to jot down some notes, don't feel flustered. It's going to be there afterward. Also, some housekeeping, there is a chat function on here. So as questions arise throughout today's discussion, feel free to drop them there in the chat. And at the end, when we have question and answer time, we will get to them, I promise. So without further ado, I would like to introduce today's guest, Dr. Michael Carletti, and we're going to be talking about skin cancer awareness. So thanks for being here.
Thanks for having me, and hope everyone's staying safe and healthy.
Absolutely, yeah. As you can see, I'm home, so I'm secluding myself. Well, right off the top, let's talk about your background and training. How did you get into dermatology?
So I have a unique background. I started off, I actually went to my school here in Fort Worth, did undergraduate locally, and then was a graduate here of UNT HSC TCOM. And then I went to the military for a little over 8 years. I was a primary care doctor. I was a active duty flight surgeon for the Air Force. And then following that, I came back to the Health Science Center and completed my dermatology residency and stayed on as an assistant professor since 2018.
Wow. Well, you kind of done it all then. Well, thanks for being here with us. We're glad you came back.
I'm glad to be back, and thanks for having me.
Of course. So what interested you about the field of dermatology?
You know, it's very unique. After being in primary care, some of the challenges with primary care is compliance. Because, a lot of times in primary care, you're dealing with conditions that the patient can't see or feel. And so in dermatology, it's very different, right? It's your skin. So it's the largest organ in the body. And lots of times people are very compliant because there is something they want to either fix, get improved, or make something go away. And so, compliance it's neat to see the patients be involved in their own care. And it's great when, they can see change and improvement from a condition they might have had for several years.
Absolutely. Yeah, definitely something we can all acknowledge because the internal stuff, we don't know what's going on.
Absolutely. It's very hard to, feel things that you can't feel.
Absolutely. So as the days are getting hotter, here in Fort Worth, we're having some hot days in a streak, about 100 degrees, and people are starting to go outside, do those activities more often. Do you have any recommendations for folks protecting their skin?
Well, yeah, the key is photo protection, right? And it comes in many different ways. Obviously, everyone's familiar with sunscreen, and the joke is sunscreen, sunscreen, and more sunscreen. The key is SPF, right? And so that's the common number associated with the sunscreen. You want to look for something that's SPF 30 or higher. Mm-hmm. There are a couple companies that make some SPF 100s. And what SPF is, it's sun protection factor, and it's the amount of time it takes for the skin to redden post sun exposure. So we definitely recommend 30 or higher. I like between 30 and 50. The important thing about applying it is you want to apply it approximately 15 minutes before exposure. And then you want to read the fine print. Every sunscreen is a little bit unique or different. They say reapply every 80 minutes, anywhere between 80 minutes and 2 hours. So the most important thing is reapplying. Reapplying after, water use, water activities, sweating, things like that. But even if you're just outside and not have anything with water or sweating, you still want to reapply every 80 minutes to 2 hours. The hottest part of the day is obviously between 10 and 2. That's when the sun's the strongest. Before 10, it's a little bit less damaging rays, and after 2 to 3, it lightens up as well. So the most important thing is photo protection and sunscreen and reapply. And another convenient thing, or another thing you need to look out for with SPF is, or sunscreen, is broad spectrum. Most sunscreens by default is just UVB. You also have to worry about UVA. So UVA and UVB, you want a broad spectrum sunscreen that will cover both UVA, UVB. UVA, typically we think of aging, where UVB is burning. And that's just how we kind of, educate patients on that. But the important thing is finding a broad spectrum as well as reapplying that sunscreen. Another thing these days that's very common is UPF clothing. And so you can find clothing with different strengths of UPF. UPF is rated based on the amount of UV light that gets through. For example, a UPF 50 is going to be a piece of clothing that allows 1/50th of the ultraviolet rays through. It's approximately 2% get through. So those are things, I know it's hot out there. However, lots of companies make these breathable, UPF clothing, whether it's sun shirts or fishing gear, which are the common companies that make those. But then also you want a broad brimmed hat, something to give that good coverage to obviously, people's, face that gets the most sun exposure throughout daily activities.
Yeah, definitely. So we're saying sun exposure, but what about like the cloudy days that we've been having? Is it still important?
Yeah, sunscreen's always important. You can get damaging sun rays through cloudy days, and even through a window. If you have a nice office with windows, unfortunately, I have an office with no windows, which I actually prefer because I don't get any extra sun. However, if you have a nice window-filled office, you can still get potential damaging rays. Driving long distances, road trips, right? A lot of people during summertime will go make road trips, especially because, air travel, unfortunately, currently is not what it used to be. A lot of people are doing weekend getaways and doing long road trips. So sun exposure through windows, right? Even in the car. A lot of the tints these days don't protect with both UVA and UVB. They're typically just UVB. There are a couple companies out there that do make window tint that is UVA, UVB, but majority of them are pretty much just UVB. So that's why you want to get that broad spectrum SPF sunscreen. And I know it sounds funny, but if you're doing a long road trip, top of the hands that are exposed to sun and the face.
Got it. So what I'm hearing is sunscreen all the time.
Absolutely. So it's, and there's lots of different types of sunscreens, right? Well, the common question is, there's chemical sunscreens and physical sunscreens. So chemical sunscreens are the sunscreens that pretty much let the UV rays are absorbed by the cell, and of course intended to not cause any detrimental effects that way. However, physical blockers, the classic, lifeguard from California, with a bright white zinc nose. At least luckily nowadays they've micronized the zinc particles. So I prefer the physical blockers. That's the zinc or titanium. They're physical blockers. They don't allow the sun in, whereas the chemical blockers allow the UV to be absorbed by the cell by the chemical that's uptake.
Got it. Well, since we're talking about sunscreen, we have a participant question. Is there a brand of sunscreen that you recommend?
So it's a great question. Any sunscreen you use better than no sunscreen. And I have no disclosures. I'm not backed by any of these companies. I like just someone to use sunscreen versus not using sunscreen. The challenge of sunscreen is they become very expensive. They can be very expensive in a hurry. I prefer the sunscreens that are more liquid based. If you can kind of see, I love to have some whiskers, sometimes I have a longer beard. And so with guys, sometimes putting sunscreen on the first place for guys, it's not something that we do regularly. But lots of guys, with sweating and or with, a 5 o'clock shadow that they wear, it's hard to sometimes get that sunscreen to rub in. So there are a couple companies for guys that I prefer, and it's Elta MD or La Roche-Posay. They make a very nice physical blocker. They're typically mineral sunscreens with the physical blockers with zinc or titanium. And they actually, they rub in rather well compared to the lifeguard zinc that everyone thinks about. But there are lots of great companies. Neutrogena is another great company. Lots of times patients are worried about, in addition, obviously, to acne or in addition to sun, is like acne or rosacea. And so many of these companies also are proven to be, they use the term non-comedogenic, which means their product won't cause acne. And so that's always key, especially for face, right? Obviously, if you notice, the problem when you go to the grocery store, even online now these days, there's, countless numbers of different sunscreens. So you want to use a facial sunscreen for your face. You can use a facial sunscreen for your body, except that it's more expensive. So I use a body sunscreen and a face sunscreen. And with the body, I'll use still the minerals, the zinc or titanium, but I'll use more of a cream base versus on the face, I'll do more of a liquid type base just because it is absorbed a little bit better, at least through my whiskers and beard.
Got it. So what about spray sunscreen versus the liquid that you have to rub on yourself?
So lots of people think the spray, and they're great. Again, they're all, sunscreen's better than no sunscreen, but lots of times people, you need to, if you read the fine print on the how to apply the sprays, it says, spray 6 to 8 inches from the skin and then you must, rub in. So lots of times people like to spray because they don't have to rub it in. but you just want to make sure that you get a nice, even application. So it's not that it's bad. It's just you have to make sure that you apply it appropriately. And, every one of these products will have, directions on how to apply for best outcome.
Understood. That makes sense. Yeah. I think it's trial and error for everybody. You got to find one that works for you.
Absolutely. Absolutely. And that's, like I said, so I talked about a couple brands, LTMD, La Roche-Posay, CeraVe makes a very good sunscreen. Lots of times you can even find a facial moisturizer with SPF in there. Even days that you're not, going to be long-term. So, that's something to think about, is applying a moisturizer with a daily sunscreen in it in the morning, just for your daily use, right? However, if you're going to be outside for an extended period of time, is where you want to focus on, the true sunscreen base that you're going to want to reapply, every, hour and a half to 2 hours.
Great. Yeah. And I know, speaking as a female, a lot of our makeup products have SPF in it. So
No, that's very helpful. That's very helpful. Absolutely. It's one thing that is a benefit that you can use, that it's one less thing you have to think about. Guys, the problem with us is just trying to get in a routine of doing it.
Yes. Okay, great. So moving on a little bit from sunscreen, back to, what should we be looking for? What should an individual look for before reaching out to a dermatologist to schedule that appointment? Or is there an age or time that you recommend we go?
Sure, right. So, now granted, the most common age, kind of 30s and 40s, the literature supports that 1 in 5 Americans by the age of 70 will get a skin cancer. Most commonly, obviously everyone fears skin cancer. Why? Because it's the most common cancer in the world, right? Not only in the US, but the world. So the whole key is early detection. And so things that we look out for. So someone in their 30s or 40s is probably going to start looking, right? It's based on genetics. It's also based on cumulative sun exposure over the years. And so things that people normally come to the office for are, or that should, is, something growing, right? And we call them skin lesions, but a spot that's changing in size, shape, and color, or non-healing. Those are the common things someone should look out for, right? So growing in size, changing in size, shape, and color, and or non-healing. That's typically a common thing that people come in for. Now, people have never had one of those concerns, they normally get brought in the office because a close family or friend has been diagnosed with skin cancer. And that normally also is another reason people come in, is because they just want to get checked out. So if someone has a family history of skin cancer, that's also something to consider, in the 30s and 40s.
Okay. Better to err on the side of caution.
Absolutely. If you can catch it early, it's not a problem.
And when I come in, or anybody comes in for that cancer screening, what does that look like? What is that in-office meeting like?
Well, it's, we'll get a little bit of history. Obviously, when talk about personal skin cancer history, family history of skin cancer, your sun exposure, nowadays, obviously, tanning beds are not as popular as they used to be. However, 10, 15, 20 years ago, tanning beds were very popular. And so we now know that tanning beds increase your risk of skin cancer, both melanoma and non-melanoma skin cancers. And so those are higher risk activities that people, we as a community didn't know about, 10, 15, 20 years ago.
Definitely. And I know you're just talking about the different types. So how many different types of skin cancer are there?
Well, there's 3 common ones that people refer to. There are many more, but they're the, more rare skin cancers than the not common skin cancers, but they still present similarly, changing in size, shape, color, and or not healing. But the common skin cancers that people either have or are afraid of is, obviously, everyone knows about melanoma. Melanoma is the, quote, scary one, right? And so the other 2 are basal cell and squamous cell, based on the type of cell type that it's derived from. So melanoma are pigmented cells. They're typically pigmented lesions. They're the ones that can obviously have a higher chance of mortality. However, if you catch a skin cancer early, right, early detection and early treatment, makes it very good outcomes. So the two broad categories are melanoma and non-melanoma skin cancer, and they're handled and treated differently based on diagnosis and location. And non-melanoma skin cancers are going to be the basal cells and the squamous cells, which are the basal cells, the most common skin cancer, and squamous cells, the second most common. However, melanoma is what everyone is aware of and fears, just because of, like I said, the associated mortality.
Definitely. So what's the prognosis for skin cancer and the importance of early detection?
The key is early detection. Obviously, skin cancer is very prominent. However, the mortality is very low if caught early, right? And so we have some patients that, possibly based on, life and or socioeconomic, sometimes, they might go years without, skin cancer screenings, or even they might have a biopsy proven skin cancer and their insurance changes. And, sometimes they can't get in for quite a while. And so, the whole idea is catching it early and getting it treated early. However, there are cases, depending on the type and location, right? Kind of broad, you really can't say that what time period is going to change, right? So melanomas obviously is the highest risk for, quote, spreading. And then squamous cell is second, and then basal cell is third / the least. However, they can all happen, and they all happen at different rates for different people. So the whole idea is early detection. So if you're getting that new spot that's changing, non-healing, those are definitely concerns, at least to get looked at by a dermatologist.
Understood. So you're saying, paying attention and making sure that you're being aware of those changing spots. But for someone like me who has many, many freckles, what's the best way? Do you have any tips for keeping track of that? Because I don't even know how many freckles I have and what skin dots I have. No,
fair enough. And so obviously the importance is photo protection, right? Because they all will be changed by sun exposure. So that's obviously the key. But then obviously, on the front part of your body, anterior part of your body, arms, chest, neck, face, people can see. Backs are challenging, back of the legs are challenging to see. So that's where, you need to have a friend or a buddy that can find one for you, at least look. And or obviously that's obviously not inappropriate to come to the office for, a skin screen or skin check. You want to look at the common sun exposed areas, right? So the face, the upper chest, the upper back, the shoulders, the arms, if a place didn't see sun, it's less likely to have, the chance for a skin cancer. However, it can happen. And obviously we think of it more in lighter / fair skin individuals, but I've had skin cancers in different skin pigment ranges.
Got it. So do you think it's recommended or appropriate for someone younger than that 30 to 50-year-old age range to come in and just get that pre-screen so you know what's going on?
Well, not that there's a right or wrong answer, right? So it goes back to a specific, so if you have a family member or a family history of early onset skin cancer, or if that person has a skin cancer or has a skin lesion that's, back to the changing size, shape, color, non-healing, regardless of age. And so lots of times patients come in and just because of that, they have a fear that it may be something bad. It's not inappropriate to get it looked at by professional eyes. My youngest patient with basal cells in their 20s, as well as a squamous cell skin cancer, right? And then with melanomas, we're seeing them younger. Pediatric patients, there is a thing for pediatric melanoma, right? They typically don't get basal cells and squamous cells, but there are pediatric cases of melanoma. And so that's where, again, change in size, shape, color, non-healing are important.
Okay, just making sure we're paying attention, keeping track of all of them.
Absolutely.
So when someone comes in and they are diagnosed with a type of skin cancer, what does treatment look like for that? Is there options?
There are many options. Now, it's going to be based on which type of skin cancer it is, right? There's melanoma guidelines and, of course, the non-melanoma, basal cell or squamous cell guidelines, just based on the prognosis and the risk of metastases / spread. So they're based on location and or diagnosis, depth, cell type. Common things are we can use a topical chemotherapy cream as one option. Another option is we can, lack of a better word, we can scrape it off. The technical term is electrodesiccation and curettage. That's a scraping method. Another method is different types of surgery. There's an excision where we send off to get clear margins, and there's Mohs surgery where they can find the margins on site. And then here at the Health Science Center, we have a non-surgical option for non-melanoma skin cancers called superficial radiation therapy, where it's no cutting, no stitches, no suture, no scar, no pain method.
Okay, well, it seems like there's something for everybody, and some are less invasive than others.
Absolutely, and it's based on the patient's lifestyle, right? It's based on, is the patient a surgical candidate, is the patient a radiation candidate, and so that's why it's probably up between the patient and the dermatologist to figure out the best approach. The dermatologist can let the patient know, the suitable options. And then of course, it's the patient decision. Some patients, choose to monitor. Typically, that's a challenge we come across when we do a biopsy. and we prove it's a skin cancer, yet the patient, that spot goes away and they don't notice any changes to the skin. Well, it is possible that the cancer is all removed from the biopsy. However, it's very challenging to get clear margins off a biopsy. Therefore, we recommend going back to get the rest of it out, for lack of a better word, right? The analogy I like to use with patients is, if a skin cancer is like a tree, right? If you got a tree off at the trunk, you still have the roots to deal with, right? And the roots are not visible by the naked eye. It's typically microscopic. So it's just something to educate the patients on is, hey, that spot that you biopsied, it's a skin cancer, but hey, it's gone. Well, it's possible it's gone, but we also, want to prove it's gone.
Right. I think that's a great way of putting it. That makes sense to me, and I'm a layperson, so there you go.
That's what it's about.
Are there other skin issues, though, that we should be aware of when you're out in the sun beside cancer?
Sure. Obviously the most common is sunburn, right? Sunburns hurt, right? It can really affect your vacation if you get it on day one, so definitely, that's where the photo protection comes into play. But then obviously, sun can also lead to pigment changes, right? Lots of times, it can darken different moles or lesions, right? And so it can also cause pigmentation issues that some patients would rather not have. And then obviously one of the most common things that excessive sun can cause is precancerous lesions called actinic keratosis. So actinic keratosis are not skin cancer, but it's a precursor to squamous cell skin cancer. Not all actinic keratosis will turn into skin cancer. However, approximately 5 to 10% will. The problem, the medical community, we don't know which ones will turn into skin cancer or when.
Okay. Well, I think then this circles back to the top. What daily steps should we be taking? I know you're saying sunscreen, that covering clothing, but do you have any other tips?
No, absolutely. So the two best things that someone can do for skin health, obviously, is moisturization, right? Moisturize. You want to moisturize twice a day with a good facial moisturizer, lotion, cream, whatever your product of choosing. And then obviously sunscreen, right? You want to photo protect. Those are the two most common things. There's some other things that patients ask all the time about cosmetics. You also asked, what are some of the ill effects of chronic sun exposure? Well, one thing that people come into routinely is wrinkles, right? Wrinkles are exacerbated and worsened by chronic sun exposure. So that's one thing also that can be limited with photo protection is wrinkles. That's kind of the new thing these days, is people want to stay looking young. And so wrinkles is one of the things that kind of age us. So with that, a lot of times I get questions about where some cosmetic options when it comes to skincare. So the cosmetic options, they're countless and many. It's coined cosmeceuticals, right? So it's a combination between pharmaceuticals and cosmetics. It's not FDA approved, many of these things, so they're not studied. But lots of times companies do multiple, tests of their own. However, it's not overseen by the FDA. And so sometimes some of the studies are not, sometimes the products don't do what the companies say they do. But overall, you want to get a nice moisturizer. One of the best moisturizers on the market is a hyaluronic acid, okay? And then another great thing to use is a vitamin C, which is an antioxidant, part of your regimen. And then obviously photo protection, you want to use a sunscreen. And then one of the common things that people like for fine lines and wrinkles, anti-aging, is a retinol product. And all those are over the counter.
Yes. Great. Well, I think all of us should be taking those precautions then. We have come to the end of kind of our predetermined questions, but we have received some audience questions. And I also want to make a call to everybody. If you have any last minute questions, type them in the chat quickly and we'll get to them. So back to not talking about skin sprays or moisturizers or anything, but
Sure.
Back to seeing a doctor. Do you believe that it's sufficient to talk to your primary care physician about the spots on your skin or moles, or do you think that you need to have that more in-depth conversation with the dermatologist?
Well, it's based on the comfort level of the patient and with their primary care doctor. Dermatology is not very widely discussed topic in medical school. And so it's going to be based on how and where that physician was trained, right? Some people get a lot of dermatology exposure. Some people don't get as much. And so it's going to be unique to the person and the patient. So many primary care doctors, you have some good exposure and experience with skin cancer, but most physicians, if it's something they're uncomfortable with, they will go ahead and refer. Okay. And then of course, obviously if the patient, wants to request a referral, I wouldn't think that when I was a primary care doctor and the patient wanted to be seen by a dermatologist, I had no problem referring them to a dermatologist. So if the primary care physician is comfortable with doing it, then that's okay.
Okay, great. Well, that's good to know. I guess we should all talk to our primary care physician and see if they're comfortable or not then.
No, absolutely. Absolutely. It's just like, primary care doctors, they are able to do, many different systems, right? I know many different systems, and so if they're comfortable in handling it, then that's not inappropriate.
Okay, that makes sense. So one that just came in, I'm going to read it, sorry. It says that you mentioned 100 proof. I've heard 100 is not any better than 50, but the way that you explained it sounds like it is better. So you mentioned to use 30 to 50. So what are your thoughts on 100 SPF?
So no, there are studies that do show the higher the number, obviously it's based on the amount of UV rays that come through, right? So with for example, SPF 50, the skin reddens in approximately 50 minutes, and it has shown to keep out about 98% of the UV. Okay, so 100, it will redden at 100 minutes. Okay, now, so remember, SPFs are based on what causes the skin to redden, right? Which is the quote sunburn. And so yes, the higher the number, the better. But you get to a point where the challenge becomes with SPF 100. If you ever try to use it, it goes on thick and pasty. Mm-hmm. And so lots of times, cosmetically, people won't like to wear it because it's very difficult to get absorbed into the skin and not look like that California lifeguard from a few decades ago. Yeah. So yes, there is, do the numbers support it being better? The answer is yes. Is it significantly better? The answer is no. And that's why, lots of times I will try to get a patient to use whatever they're comfortable using. If a patient wants to go for 100, go for 100. But, the majority, the prominence of dermatology, we like to recommend at least 30, and 50 is a great number.
Okay, but even with that 100 SPF, you should still do that reapplying. Correct?
You should always reapply. If you read the fine print on the SPF 100, it doesn't say you're good to go for the whole day, right? It'll still say, apply 15 minutes prior to exposure and reapply every, typically 80 to 90, up to 2 hours, or after water or sweating activities.
Got it. Okay, we have another question. It says, is it normal for adults in their late 40s to have new moles appear if they are flat or pinpoint sized?
So there are a lot of benign things that happen with maturity opposed to aging. I use the word maturing. And so the challenge becomes is, what makes something, benign versus cancerous, right? And so it's challenging to talk about that through a telehealth visit or even a webinar, right? And so, yes, now the word mole is used loosely, right? I mean, if it's a true mole, it's not common to get true moles as we mature. Doesn't mean we can't get them, but it's not common. So sometimes new moles, for a true mole, right, you want to make sure it's not something like a basal cell skin cancer. However, there are other maturity spots called seborrheic keratosis, which if you have older siblings or your parents or grandparents even, that you'll notice these kind of flesh to medium to light brown colored, papules that, almost like they've been stuck on the skin. Those are, lots of times that's one of the most common lesion that people come in to get, hey, is this spot okay? And surprisingly, it is okay. But it's also difficult to have, a patient determine, which spot is or isn't skin cancer. For example, someone might come in for a spot in their left arm, and I might find a skin cancer in their right arm that they've never noticed or seen. It's kind of hard to teach that to a patient, but that's where, it comes with, experience and volume of cases.
Okay. I think that makes sense. I think the best advice then is to go have that discussion.
Especially if it's, especially if it's back to that change in size, shape, and color, right? And or non-healing, right? Most of us are still young enough to where if we get injured or hurt, it heals, right? So things that don't heal, that's typically a sign of something possibly, and we're talking about, We're not talking about something that's been there for a day or two. Something that's been there for weeks, right, or even months. That's when we need to get concerned.
Okay, that makes sense. So the last question that we have, it says, are either the physical or chemical blockers easier for sensitive skin?
Oh goodness. More often the physical blockers are easier because they don't get truly absorbed into the skin. If you notice on the back of a sunscreen bottle, right? If it has the word zinc and titanium, it's a physical blocker. And if it has about 4 to 6 different ingredients, it's likely chemical blockers. Those can and do, some of them do cause irritation and or allergy. Some of the best products on the market that I've had myself and had patients use is the Elta MD, or the La Roche-Posay, even though some of them, and both companies make physical and chemical blockers, that they do have, more mild. They do have some that are for rosacea prone skin, acne prone skin. A couple of them focus on, a little bit thicker sunscreen. Therefore, it won't irritate the eyes if and when sweating, things like that. Neutrogena makes a very good sunscreen as well. So it's trying to find, like you mentioned earlier, trying to find that right product that works for you and your lifestyle.
Is that a discussion that you could have with your dermatologist as well as you're trying to find a product that works for you?
No, absolutely. Every dermatologist has their favorite one or two go-tos, and I typically will use La Roche-Posay or Elta MD. I like those products. You can find them at many grocery stores. You find them on Amazon. I also use Neutrogena, right? I like to use things that are common. There's Sun Balm. There's many countless different products out there.
Okay. We did have one last question that
Sure.
before we wrap up. It says, how often do you recommend doing self-skin checks?
So self-skin checks, obviously, you don't want to check every day because then you'll kind of defeat the purpose. But, definitely for someone with skin cancer, you definitely want to get checked by a dermatologist, once a year at a minimum. Some patients, based on the diagnosis, they come in every 3 months. Some people come every 6 months. Some people once a year. Someone's never had skin cancer, then, that they should be checked out if and when they have a newer concerning spot or lesion. But yeah, if you check every now and again, a couple months, skin cancer doesn't happen overnight, right? Typically it takes, and not to get personal, I've had 2 skin cancers, right? So I had a skin cancer on my left temple that initially came up, and I saw it come up, and I was like, oh no. And then I watched it grow for a few months, and I was like, okay, it's not going away. And that's when I went to my dermatologist, got a biopsy, and ended up having surgery for it.
Well, it's a good thing you caught it then.
Absolutely. Yeah, I was staring at it every day.
Perfect. Well, do you have any closing things you want to say or any last thoughts before we get out of here?
No, I just want to thank everyone for their time and their participation, and hopefully I answered your questions. If you have any concerns, please feel free to reach out. We're here. We've actually been seeing telehealth here in the Health Science Center, but we actually are back to seeing live patients, because it's very hard to telehealth in dermatology. We can try, and it's a great option for patients that are higher risk for the current COVID pandemic. However, obviously dermatology, it's definitely a visualization specialty, and so if you have any concerns, we'd love to take care of you. If not, go see your dermatologist or your primary care doctor and make sure they are comfortable. If not, it's not inappropriate to get referred to a dermatologist just to get that initial check. And there are times where if I have a younger patient and they're worried about skin cancer, and we'll do a check, and I'll say, hey, this is maybe not something you do every year, if they're that young, but every couple of years is not inappropriate. But back to the question about when you do your own skin check, every couple of months, possibly, or just kind of keep an eye if you notice something that pops up, and occasionally we still get blemishes, we still get a pimple, but again, those things go away. So when they don't go away, that should raise our concern.
Okay, perfect. We just got to all be aware then, is what I'm learning from this.
Absolutely.
Well, Dr. Carletti, thank you so much for your time. Again, to everybody, this is recorded. We will be sending it out and posting it. So I know there was a lot of brands and stuff that we were probably trying to jot down, so you can go back and watch. But thank you so much for being here. And to everybody else, stay safe, and we will see you on the next webinar.
Great. Thank y'all. And if you have any follow-up questions, I'm sure they can get a hold of you, maybe Katie, somehow. And if you need to get questions to me, I'll be glad to respond to them.
Perfect. Well, thank you so much for your time.
Great. Thank y'all.
Bye-bye.
Y'all stay safe. All right. Bye-bye.